Chair now recognizes the gentleman from Pennsylvania, Mr. Joyce, for 5 minutes to ask your question.
Thank you, Chairman Hudson, for allowing me to join this very important hearing. The intersection of rural broadband and healthcare is critical to examine as we work together in expanding connectivity to all Americans. Chairman Carr, thank you for coming to Pennsylvania's 13th Congressional District. Thank you for meeting with the providers. Thank you for working with the poll workers and climbing those towers. Your personal impact and commitment is felt in Pennsylvania's 13th Congressional District. Rural districts, like the one you visited and I represent, are often left behind as broadband deployment accelerates across the country. Your personal commitment to not allow the rural areas to be left behind is important, and that resonates throughout America. As a doctor, I've seen the impact that the digital divide has on rural healthcare providers. Rural healthcare providers serve unique populations that are often underserved. We doctors who serve in rural areas often struggle to access telecommunications infrastructure and broadband that is essential to serve our patients. The RHC program offered by the FCC under the Universal Service Fund aims to provide funding to eligible care providers for telecommunications and broadband services necessary for the provision of healthcare today. The RHC program serves my constituents in Pennsylvania's 13th Congressional District. Connecting them and the funding and connectivity resources are important. It is crucial that we evaluate the efficiency and the effectiveness of the RHC program and how it contributes to the FCC's goal of connecting all of America. At WellSpan Health, the RHC program has allowed hospitals to maintain access to physical, behavioral, and maternal care in Pennsylvania's 13th Congressional District. Chairman Carr, as I've noted, you've visited the 13th Congressional District in Pennsylvania on more than one occasion, and you personally are keenly aware of the broadband challenges that the district faces, particularly in the healthcare industry. How do you measure the effectiveness in the RHC program and the impact of the program that we are seeing in rural communities in hospitals like WellSpan?
Well, Congressman, thank you for the question, and thanks for your leadership for Pennsylvania and for your district. If you look back just the last 5 years alone, my understanding is that almost $2.5 million have flowed to your district for rural health care, and we're seeing those funds being put to use to make sure people can have access to next generation care, and we're working together to make sure that we expand rural broadband as well to further bolster access to health care and next-gen services for the good people in your community.
As we are talking today, there are patients who are connecting with their doctors right now receiving the care that, to your point, Chair Carr, that was not available 2.5 years ago. Telehealth is a tool that has become increasingly valuable, as I've noted, in rural areas, in underserved areas. In some areas, telehealth is the most accessible option for patients seeking care. Commissioner Trusty, you said in your written testimony that you have witnessed how broadband is delivering quality care straight into rural patients' homes through video. How can the RHC program serve providers that are seeking to expand their health care options for rural patients?
Thank you for the question, and also thank you for your leadership. So as you know, the Rural Healthcare Program ensures that rural patients have access to modern healthcare or telehealth. And in recent months, we've made process improvements at the FCC to extend funding deadlines, to ensure we have the funding to meet the demand, and to roll over additional funding for the funding year 2025 to meet the needs of rural communities across the country. I think this Congressional Bipartisan Working Group on USF is another forum for us to explore additional reforms or modernizations to this program so that all rural Americans can have access to quality healthcare services.
I look forward to working with you and seeing that expansion continue. Chairman, I appreciate the opportunity to wave on to this important hearing, and I yield back the remainder of my time.